Hi there, I'm Dr. Leslie Masters from Masters MD. Today we're going to talk a little bit more about metabolic medicine. I've been trying to hit topics of metabolic medicine to help people better understand exactly what it is. It's really a way of staying healthy. One of the big things out there, I think it's amazing how you can go to Walgreens and there are rows and aisles of nutraceutical supplements, dietary replacements. We used to go and there'd be Centrum or Centrum Silver and we had two choices. Now there are supplements everywhere and it's confusing. One area that I think is really confusing is this area called detox. And I think a good way to clarify detox is to ask you one of these did you know questions. Did you know that 80% of your immune system is in the gut, in the GI tract? Now, when I talk about immune system, a lot of us go, my immune system, that's what keeps me from getting sick. Right, but how our bodies keep from getting sick is when we are sick or when we are infected with something, our bodies mount an immune response, which is an inflammatory response, which is what beats up this bacteria or whatever's causing our problem and gets us healthy again. Well, what is aging? Aging is a chronic, progressive, inflammatory response. When the environment that we live in, just about living in this world, exposes us to toxins, to insults day after day, our bodies respond with inflammation to beat off these toxins and insults from the outer world. And when our bodies respond with inflammation, over years and years, we begin to break down. Toxins that we're exposed to every day, I call it POP detox. POP detox stands for persistent organic pollutants. They're things that we're exposed to all day, every day, just by living in this world. Well, how do we get rid of these? Let me tell you how we don't get rid of them. It's not one of those things that's got you running to the bathroom 15 times a day and you think you can run it out your system. That's not how you detoxify the body. That's how you clean the colon. Some people believe in that, some people don't, but it's not how you detoxify the body. It's not drinking juices all day long or drinking lemon and honey for breakfast and every meal in between. That will not detoxify the body. It may even out an acid-base balance or hydrate you, but it doesn't detox. The only way to detox the body is through the liver. That's our detox organ. If I have a toxin right here, the only way to get rid of that toxin is to turn it into a not toxin. And how our bodies turn a toxin into something not toxic is we hook a methyl group to it, hook a sulfur group to it, hook something to it that changes what it is. When I hook something to it, if I hook a methyl group to it, this is no longer a toxin, it's no longer a threat. My liver can break it down into pieces and parts, excrete some, use some, but get rid of the toxin. There are toxins in everything we're exposed to. Wind, water, air, hairspray, makeup, deodorant, laundry detergents, pesticides, herbicides, you name them. We do know that in the world we live in, with preservatives, with growth factors, with all sorts of things, that we're exposed to a lot more toxins than we used to be. What I want people to realize is that your body knows how. You give it what it needs, it knows how. This can be the biggest source of quackery with anything with regard to health, wellness, well-being, anti-aging medicine, a lot of the gimmicks that are out there. Your body has what it needs as long as we give it appropriate nutrients. If we give it good nutrients, your body will make glutathione. Glutathione is made in the GI tract, it goes to the liver, and it's the most potent antioxidant we have. If my body or my GI tract's not making enough glutathione, can I go to the store and just take some? It doesn't work that way. Glutathione is made from glycine, from glutamate, from different amino acids that we take in through the diet. That's why good basic nutrition matters so much. But when I have that good basic nutrition, my body can do what it needs to do. Glutathione goes to the liver, it's going to help the liver detoxify. I've got a toxin. I want to turn it into not a toxin. I add a methyl group to it or a sulfur group to it. Well, where do I get those methyl groups and those sulfur groups? They come from the diet. If we have enough, for instance, glycine, it's the simplest amino acid out there, but you need it. and you need it in your diet. I had one patient come in, she didn't have enough glycine. So she couldn't make glutathione, so she couldn't detoxify her world, so the glutamate gets too high. And she comes in here, and you wanna know what my nurse said? She's out in the lobby again. Would you get her? She keeps tapping her foot. Anxiety, agitation, that sort of thing. And it's all from one amino acid missing, not being able to properly detoxify your environment. And so this stuff can snowball. It's all connected together, but it matters. Our livers can do what they need to do if we give them the proper ingredients.